Welcome back to Great Day. The birth of a baby can trigger a bundle of emotions from joy, excitement, to anxiety and fear. But it can also result in unexpected depression. For some women, it's described as baby blues, but for many others, the depression is much more severe. Here to discuss treatment options is Dr. Diana Racusin, who's back with us, maternal-fetal medicine specialist with UT Physicians, along with her patient, Jennifer Peterson. Good morning.
Good morning.
All right, that thing called baby blues, we've heard of for years, but oftentimes it can slide into something that's completely different.
Yes.
And it's hard for women to talk about because you're thinking, but wait, I should be happy that I have this bundle of joy here. Maybe it's just that I'm tired, because you're more tired after having a baby than any other time in your life. There's a complex set of things that could be happening.
Absolutely. So baby blues is a very transient adjustment period, 1 to 2 weeks after the baby's born. Maybe you're not feeling your best. Definitely there's hormone changes, but it shouldn't be persistent. Depression is changes in your functional status, your ability to interact with your family, your ability to enjoy the things that you normally enjoy.
Yeah.
It's completely different and requires medical attention.
Well, after I had my son, I thought, okay, it's just because I'm tired. And then I went into a deep depression, and I was almost like comatose, and you're nodding your head. What they found out was that my thyroid had been wrecked, and thyroid can regulate your mood and all those types of things.
Absolutely.
So that was a hormonal deficiency that was fixed through bioidentical thyroid for me. But for you, you had gone through fertility treatment, yes, so that does a number on your body as well, right?
Yeah, I went through fertility starting in 2013. I ended up getting pregnant with quadruplets.
Quadruplets,
And
wow.
Yes, ma'am. And then lost the quadruplets in 2014. So at first with that pregnancy, I thought it was just depression from losing my kids.
Yeah.
But then I remember calling my doctor one day and I was like, my husband's leaving and I don't care. And she was like, you need to come in now. That's not okay. And then with my son, I got pregnant through IVF with my son, and of course a bunch of hormones again.
Yeah.
And then they put me on medication immediately, but I kept myself from being attached to the pregnancy the whole time, yeah, because of it.
Yeah, and so there you go. When I talk about that, sometimes it can be quite complex.
Absolutely.
Because clearly something that happened, losing those children, is going to do a number on you emotionally. Yes, but then your body was doing another number, mm-hmm, on you. And so when someone comes in and says these things, what's the process that you go through to try to figure out where's the crux of the problem?
Well, so like you said, we have to look at the whole patient and their whole history and everything that's actually going on, their medical problems, their social history. There's so many different facets that contribute to somebody developing depression or anxiety. We know that women that have depression or anxiety without being pregnant are at increased risk for already developing postpartum depression. Yeah. At every postpartum visit, we give our patients a screening test that looks for signs and symptoms of postpartum depression. And that's a really big thing we do for everybody. Yeah. And if patients screen positive, or if they just tell us things like what, mm-hmm, you were telling your doctor, then actually at UT we have a great system where we have an in-office program. We have a psychologist. We can get counseling right then and there. We can get the patient set up for exactly what needs to happen immediately.
Yeah, but we have to get that patient there, because I haven't felt like, because you're like me in the sense that it never dawned on me. I just would sit there and I was almost comfortable in my just sitting there and staring. And so when did it dawn on you?
It didn't dawn on me at all with Noah. When I got pregnant with Gia, probably around 5 months, I remember reaching out to the doctor and I was like, I'm just overwhelmed. Yeah. I can't do this. I can't handle it anymore. I'm screaming at my son all the time. I'm pregnant and I'm not happy. Yeah. I'm like crying for no reason. And she was like, I need you to come in.
Yeah. And unless you've gone through it, you don't understand that feeling. We all certainly know that we paid much more attention to this after that whole case with Andrea Yates. Yes, and she went into postpartum psychosis, yes, which is kind of a little bit different situation. Explain what that is.
Well, so I think the thing is that no one chooses to have these feelings. Right. And so these changes can be as just being upset and unhappy. And for some women, it really is a psychotic episode. Right. You have thoughts of hurting yourself. You have thoughts of hurting your children. You have thoughts of hurting your family. And people in our society are embarrassed to talk about these feelings.
Well, you're a mother.
Right.
Yes. You're like, I can take care of my baby. Right. That's a primal thing. I don't question whether I can take care of my baby.
And so I think, part of my job and what we try to do is to encourage people and remind them that some amount of this is normal. Yeah. 10 to 15% of postpartum women will have postpartum depression. It's very, very, very common. And we want to see our patients and intervene before it gets to a level where somebody's getting hurt.
Which is why it's great to have that conversation when you know you're trying to get
Exactly.
pregnant, to have that conversation, and then while you're pregnant to say, okay, after the baby's born, let's watch out for some things. And so some things you mentioned to look out for, difficulty bonding with the baby, you know, severe mood swings, excessive crying, insomnia, the whole bit. Although insomnia, that's kind of hard to describe, because like you are trying to eat every hour on the hour, child. Stop it. Okay. But there are some risk factors. It can happen to anyone.
Yes.
But there are some risk factors. A history of depression, or sometimes if you're bipolar,
Yes.
Anything that hormonal in your body can really trigger some other things to kind of go wacky.
Absolutely. Also, you know, postpartum time is hard for anybody. People that lack a good support system, people that have had a difficult pregnancy, people that have had complications, maybe difficulty breastfeeding, all of those things.
Stress in itself,
yes,
right?
Difficult life events, family events.
Yeah.
All of those things play into how we adjust and how we cope in our development of postpartum depression and anxiety.
All right. Treatment for postpartum can be a number of things, not one size fits all.
Never one size fits all. So if I can encourage people that are listening to remember one thing, it's to reach out to your doctor, because treatment can look like counseling, it can look like medication, it can look like,
to take the edge off and get you through.
It can, you know, reaching out to people in the community for kind of building your own village to help with some of that social support. All of those things are really important. Support groups.
Yeah. Self-care. There's a
Self-care,
minute when because
huge.
as
Nobody
you
has
know,
time for that.
yeah, I mean, like all the way through the toddler phase, like my son would not want to be left alone. I'd be like, Mama just has to go to the bathroom.
Yes.
Are you done yet? Are you done? Please, no. Okay, so for you, there's lots of things to juggle. Obviously, mourning the loss of those children.
Yes, ma'am.
But we are happy to say, you mentioned it a couple of times,
I did.
that you have children
I
today.
do. I have 2 children.
They with us
now.
this morning?
They are.
And there they are, right there. I have to ask you your advice for a couple of things. Women who are going through fertility treatments, who are wondering if they're ever going to have that child naturally, and for those who have lost babies. Your words of wisdom and advice for them.
Keep pushing through. It's hard.
Because it's Mama. He's watching there on the screen.
It's really hard. Fertility in itself makes you crazy. I mean, the hormone changes make you crazy, and then the losing the children was hard. Actually, Noah was an IVF baby, and then Gia was our miracle. Well, how do y'all say it?
Miracle.
Spontaneous.
She was spontaneous.
Yeah, because you ended up getting pregnant with her. Yeah,
Yes,
it's like,
ma'am.
wait, where'd she come from?
I was like, wait, no, I'm not supposed to be able to get pregnant.
Yeah, but oftentimes that can happen, right?
That can happen.
Yeah.
Okay.
So yeah, you just have to hold tight to your family. You have to have that bond or support, or get it from anywhere if you can, because it's a tough time.
And again, important to point that out, because I think it hits a lot of couples. It comes sideways, and you know, oftentimes the dad is sitting there like going, I don't know what to do, because you know they're watching it all, but they feel helpless.
Yes,
so when you go into it knowing that there's help out there, then you'll know what to expect, and a lot better to go in from the very beginning than to enter in a crisis situation.
Absolutely.
All right, ladies, thank you very much. UT Physicians provides a postpartum depression and anxiety support group at no cost to new mothers 18 and up. The support group meets every last Tuesday of the month. For more information, you can call this number, 888-4UT-DOCS, 888-4, the number 4, UT-DOCS, or visit utphysicians.com/postpartum.